Thank you for your interest in the American Journal of Orthodontics Case Report of the Month. My name is Chung Hao Kao. I'm the professor and chair at the University of Alabama Department of Orthodontics. It gives me great pleasure to introduce a case today about a patient who has a significant amount of facial asymmetry that was treated with customized lingual braces and customized surgical planning. I hope you enjoy this case. Thank you. You will see in this presentation a 32-year-old woman with condylar hyperplasia and a chin point asymmetry due to that mandibular hyperplasia. You will also notice that the cuspids are missing in the maxillary arch, and there's also a significant cant to the maxilla and the face. Initial radiographs show a class 2 case, skeletal, and you can also see the asymmetry presence at the angles of the mandible and also the hyperplasia present in the condyles. Overall, no other significant findings were found on the radiograph. The treatment plan really was using customized lingual braces. In this case, they were self-ligating customized lingual braces by American Orthodontics. The maxillary arch was bonded in full, and the mandibular arch was bonded to include as many teeth as possible that will allow for the brackets to be placed. Some labial brackets were used to retract the canines. Thereafter, lingual braces were placed both in the maxilla and the mandible. And at the end of the day, the space was closed and the lower arch was managed as necessary. Most important thing was to remember that the maxillary cant was kept in full, and surgical planning involved 6 degrees of freedom and a significant amount of communication between the surgeon. We had to decide overall if we needed to keep the maxillary plane, and in this place we had to describe to the surgeon if we needed to do any amount of roll. We needed to think about the pitch, which was changing the occlusal plane, and then whether we needed to put any yaw in the maxilla. Medical modeling was used to decide where we wanted to place the teeth, and you can see in this quick video presentation the amount of planning that went into it. We kept really the upper left incisor as the reference point, and you can see all the medical modeling that is being done in this case. Medical modeling plan to include the intermediate splint and the final splint. And then because the case was lingual orthodontics in general, we had to bond attachments on the labial surface. LEFORT 1 osteotomy was done, and you can see the attachments being used to keep the intermediate splint in place. And then also checking to see if CR was present. Open. And then finally lining up the face according to the occlusion. 5 weeks post-op, and this is her settling in very nicely. Some power chain, some box elastics used to settle the bite down. Some lower lingual arch, labial brackets were placed, and then settling elastics. And I particularly like to use these W or M elastics to settle the bite into place. And that's her 1.5 years post-op. Looking very good, overall stable, and a very happy patient indeed. I hope you like this presentation and that you enjoy the article as you go into detail about what we did. And have a great day. Thank you.